Margaret Maggie Lacey had always been the kind of woman who wore strength like a second skin. At 62, she had weathered life's storms, raising 2 kids on her own after her husband passed, working double shifts as a waitress, and never once asking for help. But as she sat alone in the sterile waiting room of Jefferson Medical Clinic on a rainy Wednesday morning, even Maggie couldn't ignore the anxiety clawing at her insides. She clutched her purse tight, her palms sweating. For 3 months, she'd been silently enduring something she couldn't name out loud, something personal, painful, and, to her, deeply embarrassing. A part of her kept saying, "You're too old to be shy about your body," but another part, the part shaped by years of silence and shame, kept her voice buried. The nurse called her name, and Maggie followed her into the exam room like someone walking to the witness stand. The air was too cold. The paper on the exam table crinkled beneath her. She stared at the framed poster of the human anatomy, willing herself not to cry. Then the door opened. And in walked the doctor. A young woman, no older than 30. Petite, with a high ponytail and kind, almond-shaped eyes. She wore sneakers with her white coat, and there was a lavender pin on her collar that said, "I listen first." Her name tag read, Dr. Lena Ahmed, OBGYN. "Good morning, Ms. Lacey," she said gently, setting down a folder. "I'm Dr. Ahmed. You're here for a consultation." Maggie blinked, caught off guard. She had expected someone older, perhaps stern, someone who would make her feel more ashamed than she already did. But there was something disarming about this young woman. Something that didn't come from her credentials, but from the way she sat down, leaned in, and didn't immediately ask invasive questions. Still, Maggie found herself shrinking into her sweater. I'm not sure I should be here." Dr. Ahmed smiled. "That's perfectly okay. A lot of people feel that way." There was a pause. Maggie opened her mouth to speak, but the words stuck. "I don't really talk about these kinds of things," she admitted, finally. "It's private. Maybe too private." Dr. Ahmed didn't flinch. She folded her hands and nodded slowly. "You don't have to talk until you're ready. We can just sit for a while. No pressure." That simple offer, a doctor offering to just sit, made something in Maggie's chest quiver. They sat in silence for a minute. Outside, rain tapped the window gently. Inside, something began to thaw. "I've been having issues," Maggie finally said, voice barely above a whisper. "You know, down there. Leaking. Discomfort. Sometimes. I can't go out without worrying. It's awful. It's humiliating." Her throat tightened. Her hands trembled. "And I thought if I ignored it, maybe it'd go away. But it's not. And now I'm just scared." Dr. Ahmed didn't look alarmed. Or grossed out. Or judgmental. She just nodded, compassion blooming in her eyes. "I'm really glad you told me, Maggie," she said sincerely. "You're not alone. What you're describing sounds like pelvic organ prolapse or stress incontinence, both very common, especially in women post-menopause. And both very treatable." Maggie blinked. "Treatable? Absolutely. We can start with non-surgical options. I can refer you to a pelvic floor therapist, we can explore devices, medications. Surgery is a last resort." Tears sprang to Maggie's eyes before she could stop them. "I thought this was just my life now." Dr. Ahmed reached for a tissue and handed it to her. "It doesn't have to be. You deserve to feel like yourself again." And then, in a voice barely louder than the rain, Maggie asked, "How do you understand all this? You're so young." For a moment, Dr. Ahmed hesitated. Then she gently rolled her stool closer. "When I was 19, I had a condition called endometriosis," she said quietly. "I was in pain all the time. Doctors dismissed me. Told me I was exaggerating, that I'd outgrow it. I felt crazy. Until I found one doctor who actually listened. Maggie looked at her, eyes widening. That's why I became one, Dr. Ahmed continued. Because no one should feel alone or ashamed of their body. In that moment, something shifted in Maggie. The shame that had weighed her down for months began to lift, not because her condition had changed, but because someone had finally seen her. Not just as a patient, but as a woman, a human being. In the weeks that followed, Maggie began physical therapy, attended group support sessions, though she had sworn she never would, and gradually began to feel more in control of her life. She even started walking around the neighborhood again without fear, holding her head a little higher. One evening, her daughter, Kate, stopped by with her 2 grandkids. They sat around the kitchen table eating Maggie's famous chicken pot pie, and Kate remarked how different her mother seemed. "You've been glowing lately, Mom," she said. "What changed?" Maggie looked down at her plate, smiling softly. "I talked about something I never thought I could talk about," she said. And someone listened. Months later, Maggie returned to the clinic for a checkup. The receptionist handed her a brochure with Dr. Ahmed's photo on the front. It was for a new women's health initiative called No Shame in Healing. Maggie ran her fingers over the glossy cover and whispered, "Good for you, Lena." But what she didn't know, what Dr. Ahmed later shared in a conference keynote, was that it was Maggie who inspired the campaign. She came in afraid to speak, burdened by silence. But the moment she trusted me with her story, I saw something more powerful than medicine, a reminder of why I chose this path. Healing starts with courage. And courage is contagious. Now, Maggie volunteers part-time at the local women's center, sharing her story with others who are still afraid, still hiding behind silence. She always ends her talk with the same message. There's no shame in your struggle. There's only strength in speaking up. And when she says it, she means it, because she knows firsthand how one act of compassion, one person who listens, can transform not just a body, but a life. Sometimes, the healing begins the moment we're brave enough to speak, and lucky enough to be heard.